Our meetings this year will continue to be hybrid. Healthcare Authority staff will be on site, and board members and other attendees have the option of attending on site or via Zoom. For our Zoom attendees, our opening slide has information on how attendees can turn on closed caption. Obviously, I am not in the room. I am in Arizona. Today is my wife's 61st birthday, and she wanted to be someplace warm for it. So I apologize for not being there in person, but duty calls. Going to do roll call, starting with Carrie.
Good morning.
Good morning. Pamela.
Good morning.
Good morning, Pamela. Allison.
Oh, red is good. Yeah, I'm here. I can't use the microphone, but I'm here.
There we go. It's all a journey. Donna.
Good morning.
Good morning. Ahmed.
Good morning.
Good morning, sir. Amy.
Good morning.
Good morning. Myra.
Good morning.
And last but not least, Terry.
Good morning.
Good morning, everyone. And do we have Michael Tunick from the AGOs?
I am here. Good morning.
Awesome. And I'm Lou McDermott. I am the chair of the SEB board and the deputy director for the Healthcare Authority. With board members attending both in person and virtually, it'd be helpful for the board to hold their questions until each presentation is done or when the presenter pauses and asks if there's questions. Board members attending virtually, we're going to be watching for your Zoom hand. There's several resolutions scheduled for action today, so the public will be having an opportunity to provide comments on those specific resolutions during the normal procedure before the board votes. The public is also going to have an opportunity at the end of the meeting during our public comment period. As a reminder, if the public has questions during the staff presentation, the presenter's contact information can be included at the end of the presentation, and the public is welcome to email presenters during the meeting to capture your question for response after the meeting, sometimes during the meeting if we can make it happen, but most of the time after. Dave is going to give us an overview of today's agenda.
Morning, Chair McDermott, members of the board, Dave Eisminger. We have a relatively short agenda today. We'll talk about the minutes, but we're not actually going to vote on them. We found a correction that we need to make in them, and so we'll just delay them to next meeting, but we'll seek any other feedback, and I'll talk about that in a moment. We have the supplemental budget from the last legislative session, and Tanya's here to talk about that final budget now that the governor acted on it on March 29th. And then we have the policy resolutions, 7 of them for your vote today, 5 dual enrollment, and 2 additional ones related to school board members who can join SEB benefits. Then we'll introduce another resolution for you for hopefully action next month, which is kind of the tail end of the work that goes through the legislative funding process to do a quick benefit update for 2025 in UMP related to breast exams. Couple of other housekeeping things. Reminder, bathrooms, head out your door to the right. When you see elevators, look to your left. If we have an emergency, we go over to the parking lot that I'm pointing to in the back left. A couple of other things. Let's just go ahead and talk about the minutes, which would be the next thing on the agenda. There behind tab 3, we noticed that we accidentally omitted a description of public comment, and there was absolutely public comment at the last SEB board meeting. We have a way that we describe that and reference the audio recording, and so we'll just clean that up and then bring those minutes back with alongside of the April minutes for action in May, just to kind of clean that up. If there's any other feedback or suggestions or issues that you notice with the minutes, happy to take that feedback now as well. And I'll also say we do reference the audio recording. There was a recording issue with last meeting's recording, so there's kind of we have a plan B backup system, and so that takes longer to get it up online. And so if the plan A works, that it gets up really quickly. If we have plan B, it takes a little longer. So I don't know that that audio file is quite up yet, but it is in production, and it won't be as high quality as our normal quality audios. Just wanted to note that for everyone. So we won't ask you to take action on the minutes, but we will bring that back and clean up that public comment. That brings me to follow up from March. And the first thing I was going to talk about was a little bit about public comment. So we ended last meeting with public comment about insights on benefits 24/7. And I wanted to highlight a little bit I was reflecting on kind of the comments that I made during public comment and wanted to provide additional context on benefits 24/7. So I wanted to highlight again that when we came to the board in January for your retreat, we were about 10 days into launch, and there were not really any definition of the word many issues that had been identified at that point. I think you could count the number of things, including individual accounts, on less than 2 hands. So it was a really small number given the scale of that project. But as we went further into January and began to hit payroll cycles and more people were interacting and looking at, looking more into the system, and we were doing benefits administrators were looking at terming benefits at the end of January for people that lost eligibility, we found some more issues and began triaging and working on stabilization efforts. When that happens, we get an influx of feedback from a variety of sources, members, benefits administrators. It starts to crest into the hundreds, almost thousands of tickets that come into the system. And we also have instances where individuals understandably concerned about what their insurance status is are contacting us in every way possible. And so it's not unusual for us to get the same issue related to the same person 3, 4, 5 times. And we do our best to close every single loop, but we focus on making sure that the issue is resolved and communicated to them through at least one or more of the doors that they came into. And sometimes we don't get closed loop on all of the doors that they entered, but we do have confidence that when we resolve an issue that we are getting that back to the member, either directly if they contact us or through the benefits administrator. So there are times when individuals understandably are frustrated that they didn't get a response in a particular venue, but we have confidence that they received an answer from a venue, whether it was us or a benefits administrator. So we prioritize things that are about eligibility and enrollment. I mean, that's what the system's about, but there are times where it's escalated and prioritized based on pending surgery, somebody's medications running out. Those types of factors help us in our triaging. And then the last thing that I wanted to highlight is that we always assume everything is a systemic issue until we prove otherwise. That's just the way we operate. It doesn't matter if it's a new IT system, if it's an appeal, whatever it is, or it's a piece of correspondence, whatever the issue is that's identified, we always start from a place of it's a systemic issue. Especially if we hear about it 2 or 3 times, we know that there's more likely that there's more people that it's. So we do always approach our problem solving and issue spotting and triaging from that standpoint. The very last thing that I'll highlight on this is that we are going to have a presentation about the launch of benefits 24/7 and the 3-ish month stabilization period at the next board. So I just wanted to open up for any more questions about benefits 24/7 at this point. We are stabilizing better. I'll say the flow of tickets that's coming in from the SEB side of the house is starting to approach more normal levels. Still trying to approach normal on the PEB side. And as you'll remember, there was a lot more change that happened for PEB benefits administrators, PEB members at SEB. Anything online?
Anybody have any questions for Dave?
I have one more topic, Chair McDermott.
Oh, yes, sir.
You don't see anything on that one. I'm having a sense of deja vu. I can't remember if I did this the last meeting. I was polling a couple people and we're still not sure, so I'm just going to do some version of it. I wanted to talk about provider network disruption notices. They're becoming more present as many of our members are experiencing in the past 2 to 3 years. And so it is really kind of an unfortunate development that has happened with provider network contracting. This year alone, we've already had 2 terminations that were sent out. Both were ultimately rescinded. So as a reminder, as contracting, the expiration of a contract is coming up under OIC regulations, the notice has to go out to the member of a pending potential termination at roughly 30 days before the contract is set to terminate. And so what we're having now is, in my early days of in this role, there was a lot more pressure, and both parties really tried to avoid those notices going out. We're seeing more and more notices going out and negotiations really spilling into that last home 4-week stretch, and a lot of 11th hour deals. Literally earlier this week, the first meeting of the week that Gene and I had was to talk about exactly what was happening with the pending legacy system termination in Southwest Washington, but a deal was struck on Sunday. So he came in and was like, are we activating the plan that we're working on and going forward with our process, or nope? We learned that there was a deal at the 11th hour, and that is a common occurrence. I think the thing that's really frustrating for members is they're not experiencing it on any sort of regular basis. You know, I just said we've experienced it twice in the last 90 days for UMP. This happened 6 or 7 times since late 2022. But for members, it's only happened one time, and they don't necessarily remember that it's ever happened before. So it seems like it's a real event, and it could be a real event. It could be a real termination, and that disruption for a provider is a really frustrating and scary proposition to occur. So because this is happening on a more regular basis, we're going to be working on more general communications, including things in our newsletters about the nature of provider negotiations, the kind of this experience, so that to try to help prep people. I found that as people reach out and we describe, I know that this is a scary experience that you're experiencing right now. It is not out of the norm. It's frustrating that it is becoming more normalized, but there's, don't lose hope. There's a lot of roads that lead towards ultimate negotiations, and the vast majority of time they do actually reach an agreement. So we're going to be working on some messaging to try to help people understand that before it happens, because I do think that it's going to continue to happen on some level of cadence in the future. Pam has a question.
More of a comment. I know there was a situation in Eastern Washington earlier this year, and I just sent you an email. I said, what do you know? How can you help? And within 24 hours, I had a statement ready to give a member with information. So being able to have that quick turnaround and just to put their fears at ease was extremely helpful.
I'm glad we do. Unfortunately, we now are starting to get to more stock language because it has happened so many times. I think the other piece that I should highlight is a lot of members will say, why hasn't the healthcare authority directly contacted members in that 30-day window? Well, we're in the background often checking in with both regions and the provider network to see how things are going, to get a sense of, is this one still on a path where there could be a deal, or have communications totally broken down? Most of the time we don't have to step in. And in fact, we don't like to step in because for UMP, one of the main things that the state pays our TPA to do is manage the provider negotiations. So we're not trying to step in as much as possible. We're paying for that function to be done. And so we expect that to be done, and we monitor the performance guarantees around those provider contracting negotiations. So we try to monitor and have more of a hands-off approach unless and until we see a breakdown in communication. And there was one instance where that happened in the last 2 to 3 years. It was very clear. Both sides were confident that the ball was in the other's court. And I was like, well, you can't both be right. And so things were stalled at that point, and without some intervention, it very well actually could have led to a termination, and it didn't at the end of the day. So we're doing those types of things, but we also know that if we start to talk too much about a termination, that it might contribute to an actual termination occurring. We could destabilize negotiations because it looks like we are favoring one side or the other. But we do have things in place that if there is a significant provider disruption, that the agency could initiate a special open enrollment, for example. So we have things that are in place. We talk about what our communications plan would be and what the rollout would be if and when a termination happens. But until that actually happens, we try to describe what I just did, which is we're monitoring, the tea leaves look good. This is, there's still negotiations going on. Don't worry quite yet. That's a very hard message to receive, but that's the messaging that we try to do in that 30-day period.
I had one other question. Is there any policy movement that OIC could start to, interfere with this as it becoming a standard negotiating tactic? Because at the end of the day, you've got payer and the provider network who are more concerned with their role in this, not the individual players. So I'm just curious, is there any, or is this just a contract thing that until the contract expires, you couldn't really affect that?
I think it's one of those phenomena of whatever deadline you set, a lot of us in our work are just deadline driven. And so, like I said, the benchmark used to be everyone really tries to avoid the member communication. And I don't know that I completely agree with you, that they are focused on their networks. They are aware of the member impacts. For some reason, the calculus, and it varies from negotiation to negotiation. It's not always the provider, it's not always the carrier. It can either, depending on the negotiation, there could be different motivations for either side. They are aware, they do communicate. I'm not really sure exactly what the answer would be, that
That's
OIC could or couldn't, but I do recognize that, you know, if the answer were 45-day deadline, well, then people would just be concerned for 45 days. If it was 15 days, they'd be concerned for 15 days. The concept of an advance notice is in of itself, there's reasons for it because the terminations can happen. And we did have one in the last, I think, 3 years that actually did happen. Of course, we knew about a year in advance. The parties were like, yeah, we're never coming to agreement. We're done. We will be winding down. It was a very orderly wind down. It wasn't a mass rush with a 30-day notice. And a lot of times the parties, you know, both the parties will do a short-term extension because they're really close. And so they avoid the terminations. There's a lot of times where those termination letters are set to get put in the mail, but they sign a 30-day extension because they're close, and then they avoid that termination. I think people would be really surprised how often those letters get printed, for lack of a better word, and then don't actually make it into mailboxes. We're seeing more going to mailboxes, but there are still a lot that come really close to that deadline. So not a very satisfactory answer though.
I was just more curious of, you know, Washington's a pretty person-focused policy environment, and if there might be any movement on that. Can certainly appreciate just a deadline is motivating for people.
One of the things that I've been doing in the last, well, actually since December of 2022, is anytime I have an opportunity to talk with any of the carriers about this, I really highlight their contract negotiations. Most providers are on a 3-year cycle. So every 3 years they're up for negotiation, but it's also staggered throughout the calendar year so that they're not doing, so that the carrier isn't doing all the negotiations in October, for example. And I've been really encouraging people to get their cycles to not include Q4. It's most disruptive when those letters are going out while people are about to go into open enrollment or out of open. It's not just about the healthcare authority and PEB and SEB's open enrollment. Almost all employers' open enrollments are sometime in October, November, December. And so that disruption, and it feels like a bait and switch to members if they've made an election during their open enrollment and then in December they get this termination notice. So I've really been encouraging. Now that takes time because of those cycles, and I have seen some movement, and it's not everybody's going to move all of their contracts that way, but it is a small piece to say, to the extent we can we try to wall off Q4 for people. Any questions virtually? Terry.
Hi, thank you. I'm wondering, since this is not a huge ongoing issue, but it is an ongoing issue and it is disruptive, as you said. I'm wondering during open enrollment, if there is something that can be put out to members that in the event that something like this happens, you know, maybe not to panic quite yet, you know, you're doing stuff behind the scenes to negotiate. There will be an open enrollment period in the event of not coming to an agreement or something, because there are a lot of panicky people that reach out and they're like, we're in the middle of care, we're in the middle of this. We can't go to this hospital now because of this disagreement. So I'm just wondering if there's something we can do to give people a little bit of peace of mind to know that somebody is defending them behind the scenes, maybe.
Yeah, Terry, that I was kind of alluding that we're going to be working on communications this year, kind of in that vein, because it is occurring more often. We're seeing the value of, we already have this stock message almost that Pam referred to earlier, and saying, you know, I hate to normalize it in the community, but it's already being experienced on a fairly regular basis, that to try to provide some level of reassurance or context, I think is helpful. So I do expect that we're going to be incorporating some of that kind of content like you were describing, either in newsletters or an insert or something of that sort, or some just general correspondence and communication, so that people have a shot at understanding before it happens to them. I'm glad to hear that you're kind of supporting that kind of effort. And it's very clear to me that we didn't have this conversation last board meeting. So I'm glad I brought it up again.
Other questions or comments from the board? Anything else, Dave?
I am done.
All right, sir. Let's go ahead and get an update from Tanya Dool. She's our Finance Manager in the FSD division. We're going to be presenting us with an overview of the final 2024 supplemental budget. Her materials behind tab number 4. Tanya, welcome.
Thanks, Chair McDermott. Good morning, members of the board. For the record, my name is Tanya Duell. I'm the Urban Finance Manager here at HCA. I'm back to give you guys an update on the final conference budget. I was here at the retreat and give you an overview of what we saw in the House and Senate. Actually, no, what we saw in the governor's budget. Yeah, we passed over that version. However, it's fairly in line with what you've already seen. So next slide, please. First, we're going to talk about the final funding rates. As a reminder, the first year funding rate, that's $1,100 on your screen here, will not change. That's the year we're currently in, and we do not change the year we're in. There was an update to the school year 24-25 funding rate. It was previously set at $1,157, and it's increased to $1,178. I do want to acknowledge that change, and that is an increase. While that's not driven by significant benefit changes this year, I do just want to let you guys know that the second year changes almost every biennium due to the timing of when we're setting the plan year rates and how far in advance we're setting the budgets. That second year is always going to change. And when we look at this total change in the total spending for the program, it's about a 1% change in the total program spend. So it is a large change in the funding rate, but total program spend it's fairly small in the grand scheme. And this was really due to the rate setting process for 2024 and the projections for 2025 and where we were at the time when we set the initial biennial budget. So there was a shift from when we set the original budget to what we project 24 and 25 to be.
So Tanya, as a reminder, if I remember right, we deliver a model for projected budgeting for the governor's budget in the fall, and then there's a refresh in February for the legislature. And some of that tries to account for enrollment switching, and there was a fair amount of enrollment switching that happened, especially in the SEB side. And so some of those projections get refined. And so that's what Tanya's saying. There's updates to the model that there's specifically designed for pre-governor's budget and pre-legislative budget.
Right, and then some of the things Dave was just discussing about the provider negotiations and things that are happening currently that we try to account for in the 2025 rates that we don't quite know yet, but we want to make sure that we are accounting for some of those changes that we're not quite seeing run through our claims payments yet. So it's always just a little refinement. On the next slide, you might remember to the retreat, I talked about how the agency approached decision packages for this budget. And being that this was a supplemental budget, the agency really focused on alignment. And this was the one funding request that went through for the SEB program. This is in relation to Senate Bill 5396, which passed in 2023, that removed cost sharing for diagnostic and supplemental breast exams in the fully insured plans. And so that's happening right now in this plan year. And we requested the funding to align that for next plan year for the uniform medical plan, and that was funded. The numbers on the screen here are 6 months worth of funding because we changed benefit design things on the first of the calendar year. So this is that fiscal year conversion into a calendar year, meaning that it's worth $440,000 for the ongoing years.
For just SEB.
For just SEB, yes. All right, next slide. So a few new things that were in the final conference budget are around what we call proviso language, things that are either within the SEB specific section or in the back of the budget related to the funding rate. And the first thing is a consolidation legislative report. So this was in section 212 of Engrossed Substitute Senate Bill 5950, which was the budget bill. That states $100,000 is provided to report to the legislature by December 1st, 2024, the necessary statutory and program changes required to achieve consolidation of PEB and SEB into a single governing board, the current PEB non-Medicare and SEB active risk pools, existing eligibility provisions, benefit offerings into more aligned plans, and the report should consider ways to engage with impacted participants, options to maintain eligibility and ensure equity, and data and findings from previous reports related to consolidation. So on that last bullet, we wanted to acknowledge that this this consolidation legislative report really builds upon previous legislative reports and updates some of those components that were in the previous report from 2020. And again, that any legislative report will provide specific insights to the legislature and really is not a formal policy change, and that any changes to board structure or risk pools would require legislative action. So as we move through the drafting of this legislative report, we will bring things back to the board for discussion. And if anyone wants to note, the consolidation report from 2020 was a result of Engross Substitute Senate Bill 1190 in section 213. And then there was also an additional report that wasn't specific to the consolidation of the total programs, but there was a risk pool consolidation report that was done in 2018. So one component of this proviso language here was done in 2018, and that was a result of Engross Substitute Senate Bill 2242. I do want to pause here and see if there's any questions on the consolidation legislative report proviso.
I'll highlight that this report doesn't request a recommendation. So we'll be discussing in the report various factors and ways to think about these issues. As Tanya said, the 2020 legislative report, you know, if you were tracking this process as it went through the legislature, there was a stakeholder organization that was interested in furthering conversation towards some sort of universal system. And the consolidation of public sector programs into more singular programs is seen as a potential incremental step in that policy debate. What you think about that is, you know, everybody can have reasonable minds differing about that, but there was a request from some stakeholders to create a consolidation report. And so I do want to be clear that, you know, the Healthcare Authority is regularly asked for technical advice on writing. And so very familiar with what this language was intending to do and trying to do. It was, you know, we supported the legislature and how it's drafted. The agency didn't initiate it though. But it's also no secret that I'm really willing, able, and ready to talk about consolidation whenever somebody wants to talk about it, both the pros and cons of it. So nothing to hide there. It is also, there was a version within the budget bills that didn't pass that had a timeline associated with it. And I wanted to highlight that the 2020 report had a timeline associated with it. And if that timeline had been a real policy decision, which it can't be because the steps weren't done in a bill to actually change state law, we'd already have a consolidated program now. It would have existed a year or two ago. And so I think, you know, reports often have timelines to have agencies suggest what are the paths to get there. If you actually went back in time to the 2018 budget provision, it had a timeline, and the report we produced actually said we can't meet that timeline. But here's what you could do by that timeline, and here's what you could do to get to what you said your end goal was and how long it would take to get there. So there'll be, you know, these couple of pieces about consolidating the boards, consolidating specific risk pools. In the 2020 report, there were pieces that were highlighted as these are things the agency can do, these are things the board can do, and these are things the legislature has to do. This report is really honing in on those things that would require legislative action. And so we'll bring you back information as we go forward in this analysis. We can also, I was kind of reading the room and sending out a copy of the 2020 report might be helpful for people to have as the background. And in fact, we'll send the 2018 risk pooling one as well. I also want to highlight, because this question has come up quite a bit, that second bullet about combining risk pools is specific to the PEB non-Medicare risk pool and the SEB active risk pool. It does not include PEB Medicare retirees, which, as you know, is also K-12 retirees, but it doesn't include the Medicare side of the house. So today we have 3 risk pools. This is describing a future state of 2 risk pools.
And if you're really antsy to read it like now, I Googled PEB-SEB consolidation report and to find the report date and bill number, and it was the first thing that popped up.
So we'll send out
Yeah,
those,
we'll send it.
those 2
They're
reports.
multitasking
Yeah.
right now.
We're really excited.
We know that there is a lot of interest in this report from a lot of different stakeholders. So we definitely will bring information back as we're preparing it for submitting it at the end of the year.
Out of curiosity, will the legislature, if they were gonna move forward, ask for an agency recommendation? Or is that really just sit as a legislative decision?
Sometimes they do, sometimes they don't. Sometimes it's formal in a report, sometimes it's informal. I have to imagine if a bill is to be written, that we'll be asked for technical support on it. So, you know, we've written every bill possible. You know, fun fact, back in 2019, I think it was 2019. 2019 legislative session was the big funding question for launching SEB, and whether, you know, that ultimately ended up with, I think, $350–400 million invested that was required to fulfill the eligibility requirements that were set, the collective bargaining agreement, all of that. The big question was it going to be funded or not? We had a bill drafted to retire the SEB program in case it was needed, because we knew that, you know, the whole system was going to break left or break right, and we wanted to be prepared that it wasn't just a shoddy repeal if it needed to be, so that things weren't dismantled incorrectly. And so, you know, we're you know, ready whenever people ask. And back in 2017, when the first bills were coming out, there was requests to write a consolidation bill. So there's drafts that have existed for literally decades. You know, this report is kind of describing similar to the state that existed in state law in 1992 that then got partially repealed in 1993. So what's old is new, what's new is old.
No more original thoughts.
Yep.
Thanks.
So keeping with the theme of provisos, next slide, there was an additional proviso around obesity and weight loss treatment drugs. So in section 903, that's where the funding rate is in the back of the budget. There was additional language that states that the rates are not sufficient to add coverage of prescription drugs for the treatment of obesity or weight loss. The authority shall not add coverage of prescription drugs for the treatment of obesity or weight loss without a specific appropriation from the legislature. And nothing in this section requires removal of any existing coverage of prescription drugs to treat diabetes. So as you're all aware, similarly to what we just described with, you know, breast exam screenings, there's one route that we can go to enhance our benefits, and that is the legislative funding process. And John, you know, describes that, you know, big cycle, probably every year, where funds are requested via the budget, and then we do a decision package that's either funded or not by the legislature. In addition to that legislative funding process, the other route that there is the board has language authority that states they can swap benefits in a cost neutral fashion. Come back to that question I'm assuming you're going to have. But in order to do that, you have to swap something that's the same exact cost. And given the size of our fiscal note for 6182, I'm not sure that's feasible for the projected cost of these drugs. Dave, do you need anything else you want to add on this one?
Because of the curious question mark
Yeah.
of swapping benefits. Can't remember exactly what year, I guess it was 2 or 3 years ago. There's an example where the board, both boards swapped some benefits and changed the structure of the chiropractic, acupuncture, and massage benefits. And there was a little bit of trading within that, and that package together was projected to be cost neutral. And in fact, when we went back and looked, it was actually cost neutral. Individual components were cost neutral, but when you did all three at the same time, the suite of that change allowed an enhancement in some aspects of the benefit and a curtailment and a little bit of the other, but based on utilization, it wasn't really seen as a takeaway. But that was an example of kind of the swapping scenario. And so the board typically has that authority. The challenge here is, well, now with this language, for obesity drugs, the board wouldn't have the authority. Tanya is foreshadowing that the scale and magnitude of the projected impact, you would have to make substantial changes.
Substantial.
For the fiscal note for the entire agency, Medicaid, PEP, and SEB, was the equivalent of the SEB program.
Those
For-
drugs are expensive.
For just that drug, or maybe the PEP, somewhere between 2 and 3 billion.
It's the total PEP spent, but yes.
Yeah, so PEP is slightly spendier than SEB, so it was actually the total PEP spent annually. That's how much magnitude.
It's probably not an individual benefit that could be. So along those lines, in section 213, there was an additional legislative report that states by December 1st, 2024, the authority shall submit a report to the legislature describing options and a recommendation for possible future coverage in the Uniform Medical Plan for FDA-approved GLP-1s for the treatment of obesity and weight loss. So there'll be a second legislative report that we are doing this year. And that is it for the updates for the supplemental budget. Any other questions?
All right, thank you, Tana.
Sorry, I did have one quick question. So when you're considering, just in this case, the GLP-like medications, when it comes to costing, is it just for the benefit itself, or does the board or the costing take into account money saved for chronic disease management down the line? For example, it's been shown that like taking these medications, you have better cardiovascular health outcomes. So if 5 years down the road, you're preventing a heart attack by coverage of this medication now, that's a cost savings to the insurer. So I'm just curious, like what goes into the costing calculation?
Right, so where we can cost out ROI, we do cost out ROI.
Okay.
For this specific analysis, this was just the cost of the drugs times the prevalence of our population and what we think the utilization would be, net of rebates. We did not account for any other costs, either savings or additional costs for, members that would have additional side effects or anything from these drugs. There was nothing besides just the drugs and the rebates.
Okay, and then
So I
just
have a-
another, oh, sorry, go ahead.
Oh, I was just going to say I have a couple thoughts about that. One of the difficulties with doing something today that's going to cause downstream savings is that in the way the legislature is, the way they're made and the way they're required by regulations to do the budget, for them, it would not be a savings. They couldn't bank savings in future legislative cycles, 6 years out, 8 years out, 10 years out. They're doing their 2-year budget with a 2-year outlook. So sort of 4 years total. So that is a catch-22. And that was something that came up during the hepatitis C discussions, right? When it came out with the cure, it was very, very expensive, but the downstream savings, and you could almost argue some of those savings would actually be transferred to Medicare because people would start having issues at that time. So it's always very challenging when something we do today is going to save money down the road. It's frustrating.
Yeah, then that's part of my question. So I appreciate that insight. And I'm also curious, as you're thinking about costing, and this is just for my curiosity mostly, is if you have a prevalence in the SEB population and projected uptake of it, are you then able to see if you're able to purchase it at a cheaper rate, or is it just based on what it's being marketed as right now for the drug?
I have to go back and look at the actual details of what our pharmacy team used to provide us the cost of the drugs for the fiscal note. I don't know off the top of my head what those assumptions were.
Okay, just here. Thank you so much.
Other questions for Tanya?
Hi, my name is Angela Forcum, and I just have one question in regards to the Mounjaro, all these different drugs. First of all, thank you for taking this on as an issue. I know that there are many of us that are also looking further down the road, like you just mentioned, into the Medicare timeframe. What I really want to know is there a lobbying group that has been tasked with this, or that we as members can come alongside of and, help in this effort?
Is this a
Hi,
member of the public?
Yeah, I was gonna say
Yes.
this. I would just suggest if you can drop an email to the presenter, Tanya, the last slide, then we'll do our best to answer questions that you have.
Okay.
We typically are addressing board member questions during the board meeting, but happy to do follow up with members of the public if you just drop an email to the presenter.
Okay, thank you.
Thank you. Any additional questions for Tanya from the board? Tanya, thank you so much.
Thank you.
Next up, Stella Ng, Policy and Rules Coordinator in the ERB Division, is bringing back 7 policy resolutions and introduced at our last meeting for voting today. After Stella reviews each resolution with us, I'm going to ask for a motion to adopt. A second, I'm going to invite for public comment on the resolution, and we're also going to ask for discussion from the board until we're ready to vote. We will ask for public comment specific to each resolution one at a time. Please make sure when you raise your hand and give comments on the resolution that your comments are about that specific resolution. Materials are behind tab number 5.
Good morning, Chair McDermott, members of the board. My name is Stella, Policy and Rules Coordinator from the ERG Division. Here are the 7 resolutions for action today. Next slide, please. The first 5 resolutions address dual enrollment prohibition for implementing PEP vision coverage. I will go over a revision on the example for resolution SEB 2024-03 and a slightly revised version on the resolution SEB 2024-05. Next slide, please. The last 2 resolutions address continuation coverage for a school board member and the dependents when a school board member's term ends. We are bringing you a slightly revised version on SEB 2024-06. The next 2 slides, slide 4 and 5, are included in the presentation, so you will have them available as you consider the policies we will discuss. Slide 6 was included at the March board meeting, explaining the amendments made to the 5 dual enrollment prohibition resolutions passed by the board in 2021. And then next slide, please. So in general, we received 2 responses from stakeholders, and they share no concerns on the 5 dual enrollment prohibition resolutions. So the first 3 resolutions are amended to include PEP vision as appropriate. We have a revision to the example on resolution SEB 2024-03. If the board has no questions on resolution SEB 2024-01, 2024-02, and 2024-03, I will go over the revision on the example on slide 10.
Quickly, as a reminder, in your appendix are the track change redline versions that were presented last week. We're just showing you as the main part of this presentation, the clean copy that we're asking you to have. But the track changes that were presented last time are in the appendix as needed.
So let's go over slide 10. So in the parallel example, we have made a technical correction on the answer because longevity is the determining factor. So the answer for how does HCA resolve the school employees dual enrollment is revised to read as Palo will be kept in PEP dental and PEP vision will be auto disenrolled from SEB dental and SEB vision.
Yeah, this was a mistake that Emily highlighted last meeting where we just had the example mixed up our PEPs and SEBs.
And moving on to slide 13, please. On resolution SEB 2024-04, we have no stakeholders feedback on this one. And moving on to the next resolution, resolution SEB 2024-05, we have a slight amendment to this resolution on the spelling for PEP that's highlighted in red mark. Strike through. So are there any questions from the board before the board takes an action?
Fun fact on this one is that's how it was passed in 2021. No one noticed it then, but we noticed it now. And while we're in there, might as well clean So the fun, long-running joke with Connie, everyone asks, does PEB have two Bs or one B? Well, it depends on if you spell the word board or not. So, but there's not three Bs at PEB.
If the board has no question, then I will turn it over to.
Sorry, I did one quick question, and it's just regarding dual enrollment. Could you just tell me just what prevalence of the PEB and SEB, like where the two Venn diagrams overlap with each other, and what require action by members based on these resolutions?
That's a great question, Obed. We haven't, I feel like we knew that question and answer in 2021. At this point, I think I'd want to bring follow-up as to kind of what the general overlap is. The policy idea behind here was in 2021, the legislature passed a bill that prohibited dual enrollment within or across the program. So you can't be PEB dual enrolled, SEB dual enrolled, or PEB dual enrolled. And that a lot of that had to underlying to do with how benefits are coordinated across plans, and that in some instances there were benefits to members. Well, it really just comes down to a policy decision as to how much you want to spread the benefit or allow some doubling of benefits in some instances. And the PEB program for decades had a informal, or well, it wasn't statutory, but there was a policy of prohibiting dual enrollment. The legislature had defunded that a couple of decades ago. And so that question was coming up with the launch of the SEB program, because dual enrollment had generally been allowed in different parts of the state in the K-12 system prior to 2020. And so you had a instance where essentially PEB dual enrollment was disallowed, and there was an open question on the other permutations. The legislature enacted a prohibition of dual enrollment in its all forms. And then we had to bring to the board various policy resolutions to effectuate that. A lot of these resolutions are really primarily about what happens if somebody doesn't engage and make an affirmative choice in rectifying their dual enrollment. It's a lot of complicated rules. I mean, that it was mind-numbing, I guess, is the way I remember it from 2021, especially because there's even more resolutions on it in the PEB program, and then kind of orchestrating the catch and release phenomenon, because each board only has certain levels of authority to do within their own program. But this was really, we do a lot of communication to try to prevent the dual enrollment. Now with benefits 24/7 and both systems from being able to talk more together, there's a better way to real-time adjudicate. It's not perfect. It's better than it was. It can be better going forward. But it's all designed to kind of effectuate that policy decision. So that's some context. I don't know if I've really answered your question, and I have to follow up on the volume question afterwards.
But it's really helpful context. Thank you.
Other questions or comments from the board? All right, thank you, Stella, for the summary. The first 5 dual enrollment resolutions are lengthy and work together as a set. We spent a significant amount of time reviewing the underlying proposals 3 years ago, and these were relatively small adjustments to the core policies approved back then. Stella and Emily read them in full last meeting. We received little feedback on these resolutions, and there are no substantive changes to any of the resolutions. And under the Roberts rules, we have the ability to not read the full text of these resolutions if they've been distributed to members in advance of the meeting. And also the public has had access to them since Monday. Does any board member have concerns if I do not read the full text of each of the 5 dual enrollment resolutions?
No. Please.
Thank you so much. I'm going to entertain a motion to adopt all of the following resolutions. Resolution SEB 2024-01, amending Resolution SEB 2021-02, school employees may waive enrollment in medical. Resolution SEB 2024-02, amending Resolution SEB 2021-03, SEB benefit enrollment requirements when PEB benefits are waived. Resolution SEB 2024-03, amending Resolution SEB 2021-05, resolving dual enrollment involving dual subscriber eligibility. Resolution SEB 2024-04, amending Resolution 2021-07, resolving a dual enrollment involving a member with multiple medical enrollments as a dependent. And Resolution SEB 2024-05, amending Resolution 2021-08, SEB benefit automatic enrollments when PEB benefits are auto disenrolled. Is there such a motion to adopt this set of 5 dual enrollment resolutions?
So moved.
Thank you. Is there a second?
This is Allison, I'll second.
Thank you. Are there any comments from the public? Dave, I'm relying on you to tell me yay or nay.
None in the room, and I'm double checking that there's nothing virtually. You're good.
Okay. Any comments from the board? This will be a roll call vote, starting with Carrie.
Aye.
Pamela,
Aye.
Allison,
Aye.
Donna,
Aye.
Ahmed,
Aye.
Amy,
Aye.
Myra,
Aye.
Terry,
Aye.
and Lou, myself, is aye as well. Resolution SEB 2024-01 through SEB 2024-05 passes. Thank you so much for not making me read all these. All right.
Moving
Next.
on. Next slide, please.
And we've got two more remaining resolutions not related to dual enrollment, but we're going to vote on, and so we're going to just vote on those separately.
Yes, that's correct.
And Dave, are we going over those now, or am I going into the vote?
We're going over those now. Stella will go.
Yes, sir. Got it.
Resolution SEB 2024-06 addresses continuation coverage when a term of a board member of a school district ends. We made a technical correction in the resolution as highlighted. So next slide, please. And here's the resolution language, and we received no stakeholder feedback on this resolution. Are there any questions from the board before I turn it over to Chair McDermott?
All right. Hearing none, we're going to take a vote on Resolution SEB 2024-06, continuation coverage when a term of a board member of school district ends. Resolve that a board member and their dependents who are enrolled in SEB medical, dental, and vision who lose eligibility when the board member leaves office or their term ends may continue enrollment in SEB medical, dental, or vision coverage for a maximum number of months allowed under COBRA. Is there a motion to adopt?
So moved, Pam Cruz.
Is there a second?
This is Allison, I'll second.
Any comments from the public? Hearing nothing. Any comments from the board? This as well will be a roll call vote, starting with Carrie.
Aye.
Pamela,
Aye.
Allison,
Aye.
Donna,
Aye.
Ahmed,
Aye.
Amy,
Aye.
Myra,
Aye.
Terry,
Aye.
and Lou, aye. Resolution 2024-06 passes. Thank you, folks. Stella, back to you for number 7.
Thank you. Next slide, please. Resolution SEB 2024-07 addresses continuation coverage when a dependent of a school board member loses eligibility when they are no longer an eligible dependent under the SEB program. And we received no stakeholders' feedback. Are there any questions from the board?
All right, we're going to go ahead and vote on Resolution SEB 2024-07, continuation coverage when a dependent or of a school board member loses eligibility. Resolved, a dependent of a school board member who is enrolled in medical, dental, and vision, who loses eligibility because they are not an eligible dependent under the SEB program, may enroll in medical, dental, or vision for a maximum of 36 months on a self-paid basis. Is there a motion to adopt?
So moved.
Is there a second?
This is Allison. I'll second.
Are there any comments from the public? Are there any comments from the board? This again will be a roll call vote, starting with Carrie
Aye.
and Pamela,
Aye.
Allison,
Aye.
Donna,
Aye.
Ahmed,
Aye.
Amy,
Aye.
Myra,
Aye.
Terry,
Aye.
and Lou. I. Resolution 2024-07 passes. Thank you, Stella, for bringing us all those resolutions. Appreciate that. Thank you, board, for approval. We will incorporate those.
We will issue guidance to the SEB organization on these resolutions, and we'll incorporate resolutions into the SEB program groups. Thank you.
Excellent.
Hopefully we won't.
Next up, we have
full enrollment for another 3 years.
Next up, we have Ryan Ramsdale, UMP team manager in ERB division, is going to be presenting us on some benefit design changes in the SEB program. The resolution he is introducing is not scheduled for a vote today. Ryan's materials are behind tab number 6. Ryan, welcome.
Chairman McDermott, members of the board. So I'm here to present a UMP benefit design change that is being proposed as a resolution to go into effect January 1st, 2025. Next slide. So we are going to discuss diagnostic and supplemental breast examinations and coverage related to that. And then I will go over a proposed SEB board resolution, which we'll vote on in May. So this is a benefit change related to diagnostic and supplemental breast exams to be covered at no cost share to uniform medical plan members. I have to acknowledge that federal law requirements apply to qualifying high deductible health plans. A little bit of color behind this is that many of the United States Preventive Services Task Force makes determinations every year on those sort of services that should be deemed as preventative in nature. Components of the Affordable Care Act, as well as other legislation, requires that preventative services are typically covered at no cost share. But the important word up there is diagnostic and supplemental. So diagnostic services typically are at a cost share. When I speak cost share, I'm speaking to after your deductible, you often might have a copay or a co-insurance. So this Senate bill was passed in 5396 was passed in 2023 to affect the 2024 plan year, but it was directed at the fully insured carriers. And so the intent here is that UMP wishes to align with that Senate bill and move the self-insured program or the uniform medical plan to also apply the same standard for the supplemental and diagnostic breast exams at a no cost share. Next slide, please. So the proposed resolution that you'll vote on next month, proposed resolution SEB 2024-08, UMP diagnostic and supplemental breast exam coverage. The resolution goes as such, beginning January 1st, 2025. Diagnostic and supplemental breast exams are to be covered without member cost share to uniform medical plan members for in-network services. UMP high deductible members need to meet their deductible before the plan will pay any portion of the claim. Next slide. So as typical, we seek any sort of board feedback. We'll incorporate that into our response in May. The email address is there as well as in your slide deck. And then we will bring this back on May 2nd for considerations and a vote. Any questions on that? I know that was fairly brief.
I will highlight, the reason that we seek kind of alignment of benefits this way is to kind of help standardize the benefit as much as possible. Sometimes it's the fully insured that leads the self-insured, and sometimes it's the other way around. So we really do try to monitor. We make sure during legislative session that if there's a bill that only impacts one, that legislative staff and sponsors are aware that it does that. and then they can make their choice, and we offer up technical support. I said that a lot today, to write things however they're really trying to achieve it. Sometimes they just want to go forward with a subset, and then, you know, it's been a while since we've done an alignment package like this to where self-insured is catching up with fully insured. It's more often the other way around, but this is one of the things that we do just to try to help standardize things across the portfolio.
All right, thank you.
Thank you, Ryan. Appreciate it. So we're scheduled for a 10-minute break, but we're ahead of schedule, and I'm wondering if we want to go to the next presentation or if folks would like to take a 10-minute break. Either way. Board members, what are your thoughts?
Keep going.
Keep going?
Do keep goings and a head nod supporting.
Keep going.
Keep going it is. All right. Stella, come on back. There you go. Stella's going to bring us to present an annual rulemaking briefing for the SEB program. Her materials are behind tab number 7. Over to you, Stella.
Thank you, Chair McDermott. Members of the board, for the record again, my name is Stella, Policy and Rules Coordinator for the IRB Division. I'm going to go over high-level information on this year's annual rulemaking and highlight the most significant changes and rulemaking actions we are considering making. No action is needed from the board for this briefing. Next slide, please. Here is the tentative rulemaking timeline. In May, we will file proposed amendments, CR 102, and distribute new rules for public comments. In June, we will conduct public hearing and adopt final rules, CR 103. And in January, permanent rules will become effective. Next slide, please. The focus of this year's rulemaking is divided into 3 different areas. We will implement the 7 SEB board policy resolutions that passed by the board this year, as well as we're implementing final rules for the 2023 legislation. We're adding clarity to rules to better administer and manage SEB benefits as identified by staff and stakeholders, and we are making changes to comply with federal requirements. Next slide, please. From the 2023 legislation, we're implementing final rules for Senate Bill 5700. This is our agency request legislation. We're making global changes by updating definition sections in all 6 chapters of our Washington administrative codes between the PEB and SEB programs. Under Substitute Senate Bill 5275, we are creating 5 new WAC sections that address employer group participation requirements in the SEB program, such as the application process and how HCA approves or denies a group application. We're also adding a new WAC section that details school board members' participation requirements. Under House Bill 10008, this legislation changes the definition of separated employees and impacts school employees' eligibility for the PEB retiree insurance coverage. It includes PERS-2, SERS-2s, and TERS-2 members who separate from employment on or after January 1st, 2024, and who are at least age 55 and have at least 20 years of service. They are eligible for PEB retiree insurance coverage either to enroll or defer if they meet this eligibility criteria without the requirement to immediately begin receiving a monthly retirement benefit. And we are also running emergency rule this year on Substitute Senate Bill 5275 and House Bill 10008 while we are conducting permanent rulemaking. Next slide, please. Under Administration and Benefits Management, we are amending premium payments and premium refunds rule to include an exception when a subscriber is not required to make the first premium payment and applicable premium surcharges to begin new enrollment. For example, When a self-pay subscriber is changing from continuation coverage to PEP retiree insurance coverage, because they're already making payments and there is no break-in coverage, we will move them to the new enrollment status without the need for them to meet the 45-day first payment requirement. And we're clarifying the documentation process for spousal attestation due to a change in the spouse or state registered domestic partners employer group medical plan. This is to align with our special open enrollment requirements. Next slide, please. And we're amending the premium payment rule to add a special open enrollment event when there is a substantial decrease in the providers available in the SEB health plan. And just as a follow-up, we added a special open enrollment event last year on this particular this SOE event last year. This is just a follow-up as we identify this additional rule that we need to implement this SOE. And we're clarifying the error correction rule on the effective date of supplemental life and supplemental AD&D insurance coverage when correcting an enrollment error. And we are clarifying when a school employee enrolls a dependent in supplemental dependent life insurance or AD&D insurance, the required form must be submitted within the required time frame. Next slide, please. Under regulatory alignment, we're clarifying that a oversubscriber's coverage will end when their Medicare coverage begins. And are there any questions from the board? Thank you very much for your time.
Thanks, Stella.
Thank you.
We're at public comment. And Dave, I would ask if you could run the public comment, because obviously I can't see Mackenzie. If there's anyone from the public who would like to comment, now is your opportunity. Please raise your Zoom hand so we can get you tracked and lined up.
Don't have anybody here in the audience, just checking and okay, we'll check in. We know that Fred, you can go ahead and then we'll check in if anybody else is still raising their hand, but definitely go ahead, Fred.
Good morning. I just wanted to reinforce a statement that was made earlier by a member of the committee that when you're doing the study on the obesity drugs, and I sent an email to this effect as well, that I'm in full support of opening the study to look at the savings you will gain by preventing future problems as a result of treating obesity. And I know how difficult that is to measure something that has yet to occur, but I think it's a critical piece when you're analyzing the value of using a drug one way or the other. So I just wanted to reinforce that message. I think that would be very important in the study to mention, in addition to just the flat cost issue. Certainly there's a cost, but there's also a consequence, fairly positive consequence. And I believe there might be research out there that may project savings as a result of a treatment of obesity. That's all I have to say. Thank you very much. Have a nice day, and congratulations on, I thank you for such a short meeting.
Thank you,
Thank
Fred.
you, Fred. Appreciate it.
Anyone else, Mackenzie? All right, I think we are completed public comment.
All right. Our next meeting is going to be May 2nd, starting at 9 a.m. We're going to use the same format, except I will be there in person. Again, do apologize for not being there today. I like to stay in town during board season. Dave, any final comments before we adjourn?
Just a couple of things. Previewing next meeting, we'll have the resolution back from Ryan about the UFB benefit design. That benefits 24/7 stabilization presentation that I described at the beginning of the meeting. And we also will have a presentation about the premium payment program, which is really a follow-up to last meeting when Donna, you asked some questions as we were talking about FQHCs and CMAR and that. So we didn't have enough time to quite get it for this presentation, but it's on deck for bringing back next meeting. I also wanted to highlight, this was a really short meeting, and in case people were like, why did we have such a short meeting? Could we have just delayed it to May? Just out of curiosity, we are always thinking about those things. But in order to meet the rulemaking timelines and have things be in effect in January, we have to file them in May, which means we needed you to have action on resolutions in April. So it might have seemed like a very short meeting, but it was critical for the timing of rulemaking pieces. So just wanted to highlight why we, if I could cancel a meeting, I will cancel a meeting and stack things together. This was these were the necessary things that have to happen in April here. So appreciate everybody's indulgence. I know some of you are on spring break. We can tell that people are on spring break. Have a little bit less correspondence, a little bit less questions coming to the agency from all angles. And so just appreciate your time. Back to you, Lou.
Yeah, I just want to thank the board members for making time. You always are in attendance. You're always very attentive. You ask good questions, and it is appreciated. As well as Dave's staff who put all these materials together, and Dave who prepares for these. And yeah, just want to thank everybody. It was a smooth meeting. Really appreciate it. And I hope you all have a good day and enjoy spring break. Take care, folks. This meeting is adjourned. That was my rock. I didn't bang it so hard. I can stop.